Hey everyone, and welcome to Animate Your Health. Ready to truly understand your health? Hit that subscribe button and let's get started. Ever wondered what those two numbers mean when you get your blood pressure checked? It's more important than you think. Blood pressure is simply the force of your blood pushing against the walls of your arteries as your heart pumps it around your body. It's a vital sign of your cardiovascular health. When you get a reading, you'll see two numbers, like 120/80. The top number is your systolic blood pressure. This is the pressure in your arteries when your heart beats, pushing blood out. Think of it as the peak pressure your arteries experience with each heartbeat. For people over 50, it's often the most important number to watch. The bottom number is your diastolic blood pressure. This represents the pressure in your arteries when your heart is at rest, between beats refilling with blood. It's the lowest pressure your arteries experience during the cardiac cycle. Both numbers are measured in millimeters of mercury. Now, let's break down what those numbers mean for your health. First, normal blood pressure. That's typically anything less than 120/80. If you're in this range, fantastic. Keep up your healthy lifestyle. Then there's elevated blood pressure. This is a systolic between 120 and 129, with a diastolic still less than 80. It's a clear warning sign, meaning your pressure is starting to creep up. Now's the perfect time for lifestyle changes to prevent it from getting worse. Next, we have high blood pressure, or hypertension stage 1. That's a systolic between 130 and 139, or a diastolic between 80 and 89. If you're in this range, your doctor will likely recommend significant lifestyle adjustments and potentially medication, especially if you have other risk factors for heart disease. Even more serious is high blood pressure stage 2. This is a systolic of 140 or higher, or a diastolic of 90 or higher. At this point, your doctor will almost certainly recommend both lifestyle changes and medication to effectively manage it. Finally, a hypertensive crisis is anything over 180/120. This is an emergency. If you get a reading this high, recheck it after a few minutes. And if it's still elevated, seek immediate medical attention, especially if you have symptoms like chest pain, headache, shortness of breath, back pain, numbness, weakness, or changes in vision. It's important to remember that one high reading doesn't automatically mean you have hypertension. Blood pressure naturally fluctuates throughout the day. Stress, physical activity, caffeine, and even anxiety at the doctor's office can temporarily raise it. A diagnosis usually comes from consistent high readings, taken over several visits or through home monitoring. Also, what's ideal can vary slightly based on your age, overall health, and any existing medical conditions. So always talk to your doctor to determine the best target for you. High blood pressure is often called a silent killer because it rarely has symptoms. But over time, consistently high pressure can silently damage your arteries, heart, brain, kidneys, and other vital organs. This significantly increases your risk for serious conditions like heart attacks, strokes, heart failure, vision loss, kidney disease, and sexual dysfunction. That's why regular blood pressure checks are so crucial for early detection and management. Understanding your numbers empowers you to take control and protect your long-term health. We've covered what your blood pressure numbers mean. Up next, we'll tackle the vital question of how to treat high blood pressure and, even better, how to prevent it. Stay tuned for essential health information. If you found these helpful, please give this video a thumbs up, subscribe for more health and wellness content, and let me know in the comments below what your numbers are. Thanks for watching.